Pelvic congestion syndrome is a condition where the veins in a woman's pelvis become enlarged, stretch out, and that process will cause pain. The pain is typically a dull or aching pain, and it often happens at the end of the day or gets worse throughout the day. So as a woman walks around, the blood will not drain very well out of the pelvis, stretch out these veins which become varices. That's another fancy word for veins that are stretched out to larger than they're supposed to be. And then women will experience pain. And when they go to bed at nighttime and the blood's more easily able to drain out of the veins, they'll feel a little bit better when they wake up in the morning. Typically this is caused by valves that have broken down or stopped working in a particular set of veins, namely the ovarian vein and the internal iliac veins. Pelvic congestion is treated by an embolization of a vein. So in many people we embolize things with coils, and in this case that's what we're doing. Coils are small metallic fibers that kind of look like a slinky, but they're softer and they will fit according to the size of the vein and then block the vein off. We also use a small amount of what's called a sclerosant, but basically just a benign chemical that will cause veins to clot off. And in this case, we are embolizing the veins in the pelvis or the ovarian veins, which are a little higher up. And we cause the veins that are leaking and not draining blood well to shut down and divert blood flow to veins that will work and effectively drain the pelvis. Treatment of pelvic congestion syndrome is done as an outpatient. You'll come to our Summit Interventional location and we'll place an IV, give you some other medicines to relax, and then we'll begin to perform the embolization. We do it with X-ray guidance. We either put a catheter, which is a venous catheter. It's more like an IV. It is not necessarily like a urinary catheter. We'll put this catheter in either the main vein in your neck or your groin and then direct it into the veins that are inadequately draining your pelvis, so these leaky veins. And then we'll perform the embolization, which, as I mentioned before, is done with either coils and, in this case, a sclerosant, and we will block off the veins that aren't working and divert the flow to good veins. This takes about a half hour to 45 minutes. It's done under anesthesia, so you'll be asleep when we're doing the procedure. After we're done, you'll go back into your recovery room, hang out for about an hour, and then you'll be able to go home. And afterwards, you may notice some aching from the veins that we blocked off. That's totally normal. It should resolve in a few days. And over the next month, you'll notice that your pelvic aching and pain begins to get better.